Good afternoon, Musquechees. Today we have the Indigenous Service Canada Medical Officer of Health, Dr. Parminder Thiara. So, welcome, Dr. Parminder.
Thanks, Rebecca. It's good to be here. Thank you for having me.
No problem. So what we're doing today is we're having a questions and answers speaking on COVID-19 vaccines. So, you want to tell us a little bit about yourself?
Sure, thank you. So my name is Parminder Thiara. I'm one of the physicians with Indigenous Service of Canada, the Medical Officers of Health. There are two of us right now, Dr. Chris Serene, who's the Senior Medical Officer of Health, I have been with the organization since 2006, and my primary focus over the last 7 to 8 months has really been focusing on the vaccine rollout within FNIB and First Nations communities.
Amazing. All right, so we're going to get started. So my first question here is, what type of vaccines are available in Alberta?
Yeah, no, thanks for the question, Rebecca. So currently in First Nations communities, two types of vaccines are available. They're both messenger RNA vaccines. It's the Moderna vaccine, which currently is licensed for those that are 18 and older, and the Pfizer vaccine, which is licensed for those that are 12 and older. And they're both available in communities. In Alberta, we previously had AstraZeneca, which was also available. It's a different type, it's called the viral vector type of vaccine, and that was only available off reserve. So some of your members may have gone off reserve and accessed that vaccine, but generally the vaccines available on reserve are the Moderna and Pfizer vaccines.
Okay, wow. Next question. What does the vaccine do to protect us against the COVID virus?
Okay, no, it's a great question. So vaccines, like any other kind of vaccines that, even the routine childhood immunization vaccines, they're there to really help prime our immune response, our system, so that should it see, the coronavirus, they'll be able to launch a more effective immune response. So normally what happens if you don't have any vaccine on board, this particular coronavirus is something that our bodies have never seen before. So when they see it, they have to launch an attack right from scratch. So they've not prepared any armies. And there are two armies that we really use in the immune system is like antibodies. People would have heard that being produced, as well as some cells that can fight the infection. And what happens is that if you don't have any vaccine on board, you have to really start from scratch in terms of building that army to be able to fight the infection. Whereas if you've had the vaccine before, what it does is it takes about 14 days to develop those armies. So after the first dose of vaccine, we see that the antibodies get developed. And then after the second dose, we see more antibodies and more of that cellular, the cells that actually fight the infection that get activated and those armies get built. So after you've been immunized with 2 doses of vaccine, you essentially have a full army that is ready to go 14 days after that to fight an infection. And that's why vaccines are really effective, because now if you've got your armies are all built, when you see or you get infected with the virus, you're able to attack it right away without it really developing or getting into your cells and developing any symptoms and so forth.
Great. Oh, that sounds awesome. Okay, next question. Is the vaccine 100% effective against the virus?
So that's a great question. And so unfortunately, no, none of the vaccines that we have, like even outside of the COVID vaccines, are ever 100%. But they can be very good. So in this case, both the Moderna and Pfizer vaccine are actually really good vaccines. The data from Alberta have shown that after 1 dose, 14 days after the first dose, we see that there's about mid 70% in terms of effectiveness against fighting against symptomatic infection. And then after 2 doses of vaccine, it's roughly about the low 90 percentage points where we see the ability of the vaccines to prevent symptomatic infection, and even higher in terms of preventing hospitalizations and deaths. So these vaccines are really effective. And one of the things that sometimes people ask is kind of like, what's the difference between Moderna and Pfizer? And they're really almost the same. They both work the same way. And I kind of liken it to, think of it like one is Coke and one is Pepsi. They're just made by different companies, but they pretty much do the same thing.
How cool. I like that. Okay, next question. If I wanted the vaccine, what steps should I take?
So I think one of the things that I really recommend for individuals is, like, get it locally there from the health center. So that the health center has clinics that they're putting on, so you can give a shout to the health center or check their social media or their websites to kind of see when clinics are being put on. If people have more questions about it, they can reach out to the nursing team members at the health center, or also reach out to their primary care physician and have a bit more conversation as well if they're wondering whether or not it's the right step for them.
Okay, great. Next question, what common side effects should I expect after getting the vaccine?
So generally, like other vaccines that we've had as kind of routine childhood vaccines, what people can normally have is something we call local reactions, and that's just right where you inject the vaccine. So usually in the arm is where people will get their vaccination, and there can be a little bit of tenderness, there can be a little bit of redness, some pain, and some swelling, and usually that goes away within 48 hours. Anything that persists beyond that is generally not necessarily linked to the vaccine itself, so that's what we see as typical. And then what we call systemic side effects, so side effects that affect the entire body. So that could sometimes feel like a bit of a headache, or you might just feel very tired for a couple of days, or fevers and chills some people have experienced. And then a little bit less commonly, you can get some nausea and vomiting as well, but that's fairly short-lived as well.
Oh, wow. Okay. Next question, is the vaccine made from the COVID virus?
Yeah, so I know lots of people have this question. So no, in this case, the vaccine is not made from the COVID virus. We have other vaccines that we've used for other routine childhood immunizations, and sometimes it's where you weaken the virus and then inject. But no, in this case, there is no actual live virus at all. In fact, what the messenger RNA vaccines are about is we're essentially giving a recipe of how to make a certain protein that is on the virus that our bodies wouldn't normally have seen. And that's what primes that immune response that we talked about earlier. So it's just giving the recipe. We actually have the protein, we can make the proteins in factories already inside our cells. And then as soon as the cells have finished making that protein to show to the immune system, the mRNA, or that recipe that's been kind of inoculated with individuals, is actually just broken down by ourselves within a couple of days.
Great. Okay, next question. How long must I wait to get my second dose of the vaccine after my first?
So we recommend, and kind of as per the manufacturer guidelines, that the minimum time between the first and second dose should be 21 days. So once you get your first dose, your second dose can happen anytime 21 days thereafter. And we do encourage people to get it as soon as they can after getting the first dose.
Great.
And as long as there's that 21-day period.
Okay. Next question. If I am on isolation or currently infected with the COVID virus, can I still get the vaccine? And how long should I wait if I have to stop?
So we recommend that while you're actually, infected or have other symptoms, not to get immunized. We recommend that people wait until they finish their quarantine and isolation periods to get immunized. And the primary reason there is that just in case you have a side effect from the vaccine, it will be hard to kind of tell if it's from the vaccine or if it's from the actual illness that you're experiencing. So as soon as you're done, you can get immunized. And in fact, for those individuals who have been infected with COVID, we still at this point recommend that you be immunized with 2 doses of vaccine after you have been infected. There is, I think, just important for any of your viewers, there is work being done by the National Advisory Committee on Immunization that kind of sets the guidelines for the country and recommendations. They are looking to see what's the right number of doses for individuals who have been infected with COVID to have afterwards. So currently it's 2, but we may see a shift in that maybe sometime over the summer. But at this point, we recommend 2 doses.
Oh, wow. I didn't know that. Okay, next question. The vaccine was created too fast. How can it be safe?
Yeah. And I know I've heard this question a lot, and I appreciate that, when people are making informed decisions, this is something that they really do want to weigh. So there are some pieces that I would like to kind of convey to everyone. The first being that, this mRNA technology has actually been around for over 10 years. So researchers had started to work on the mRNA technology after SARS. So if everybody remembers SARS, which was over a decade ago, the virus for SARS kind of comes from the same family that this coronavirus, this COVID epidemic or pandemic that we're experiencing. So a lot of that initial work had started about 10 years ago. And so when we came to the pandemic, it wasn't that we were starting from scratch. We'd actually had 10 years of research that we were building on. And the other piece that I think is really important for people to understand is that across Canada, within Canada, but also across the world in other countries where the regulatory authorities who approve these vaccines for use, so here in Canada, that's Health Canada, and the US, that's the Food and Drug Administration. What was really interesting in this process is that normally manufacturers, they kind of gather all of their data. So they do their phase 1 trials, their phase 2 clinical trials, and then phase 3. And usually they gather all of this information and then submit it to Health Canada or the FDA for approval. And then it takes some time for the regulatory bodies to review it and so forth and ask questions. What they did this time is, as they were doing the clinical trials, when they moved from phase 1 into phase 2, they would send their data into Health Canada so that the review process could be started as the trials are still being done, as each phase is completed. So in some ways that also helped to speed up the regulatory approval process because the data had been submitted earlier on, and so they had more time to review it as well. So all of the same steps that have been taken to approve other vaccines in the past were also taken in this process. It was just that it was kind of being done in parallel or at the same time as the clinical trials were also taking place.
Okay, yeah, I definitely heard about the SARS, and it's been around for a while. Okay, next question. If I just get 1 dose of the vaccine, will that be enough?
So we recommend too, so, with some of the variants that were out there first, the Alpha variant and the P1 variant from Brazil, the ones that have been circulating in Alberta, we knew that we still, after 1 dose, you still have about 75% effectiveness, right? And after 2 doses, that goes up into the low 90%. The Delta variant, that's the new variant that originated in India, and that's kind of what we are seeing, across the country and kind of around the world, is becoming a bit more of that predominant variant. They're even seeing down in the United States that is the variant that, is starting to come to the forefront, where they're seeing larger outbreaks associated with it. That variant, while the mRNA vaccines are really good against it, you need both doses. So after 1 dose, in terms of preventing against symptomatic infection, it's only around the 30% point in terms of preventing symptomatic infection after 1 dose. But after 2 doses, 14 days after the second dose, it's closer to 90%. So you really want that second dose because it's also after the second dose. If you guys recall, I mentioned that the part of the immune response that is based on the cells going in and kind of fighting the infection, that part gets activated after the second dose. So we really recommend that you get the 2 doses. And I think when I mentioned the effectiveness of them, what we've seen so far from data in Alberta for individuals who have received 1 dose of vaccine, so all of the people who have at least had 14 days after receiving their first dose, we see about 0.5% of those individuals can develop symptomatic disease. And then after 2 doses, that drops down to like 0.08% of people who have been immunized with both doses that have gone on to develop disease. So it's a very small fraction, and we see a reduction after you get that second dose.
Wow, that's awesome. Great. Okay, and final question. Is it okay if we mix our vaccines?
Yeah, no, that's another great question. So the guidance nationally through the National Advisory Committee on Immunization is that, if you started out your first dose with Moderna, try to get your second dose as Moderna, and vice versa. If your first dose was Pfizer, then try to get your second dose as Pfizer. But we do appreciate that sometimes in a community, you may not have one or the other, or they may have just run out of one vaccine and it's only the other vaccine that's available. In those cases, it would still be okay to get the alternate vaccine. So if your first dose was Moderna, but they don't have any more of it readily available in the nation, your second dose can be a Pfizer, and that would be fine.
Okay. And anything you'd like to add?
Well, I really appreciate the opportunity to be here. And I know that this is, a pretty tough decision. I know lots of people need to really consider both what are the benefits of being vaccinated, with the risks of it. I think the piece that I probably want to just have people understand as well is that what we've seen in First Nations communities, so just data based off of what we've seen in Alberta First Nations communities, is that out of every 100 people that have been infected with COVID-19, we've seen at least 8 individuals being hospitalized, maybe up to 2 of them requiring an ICU admission, and 1 out of those 100 individuals will die. And that's quite significant. I know people sometimes say, well, there's all these side effects, and I think they should be aware of all of the side effects with the vaccines. But I think it's also important for people to understand that if you don't get vaccinated and you do become exposed to the virus, that there's a 1 in 100 chance of death. And what we're also seeing is up to 20% of all of those people that have been infected with COVID-19 are having what we call long hauler symptoms. So they're still experiencing either like mental health or neurological issues or inflammation of like their heart or other parts. So there are some of these longer term consequences that we're seeing, and when we're learning how to deal with those, and we don't know, like for people that might lose their sense of taste or smell, how long that might be. And that's kind of it happens not uncommonly with individuals who have been infected with COVID-19. So I think it's just being aware of that piece as well, and then making that decision for themselves as to kind of what is the best way forward for them as they move forward.
Okay. Well, thank you so much, Dr. Parminder Thiara. This is anybody who has information about the COVID-19 vaccine, and we hope that you can get vaccinated so we can go back to our normal kind of life. Thank you again so much.
Thank you. Have a great day.
You too.